Good morning. Welcome to October. Welcome to the show For the Health of It this morning. I am Dr. Scott Phillips, the host, local chiropractor and owner of Lifestyle Chiropractic and Wellness Center in the Clock Tower building. And I hope everybody had a good, crisp morning this morning. I have to be honest that I woke up and stepped outside for my morning run and decided it was a treadmill morning. It was a little too cold for me. So anyway, so it's chilly out there. We definitely had frost on the ground, and fall is here, I'm afraid. So welcome to it. Like I say, it is a new month. It is October, and I'm very excited about the topic of the day. In fact, if any of you don't know if you don't watch football in October, if you don't do about anything, I think most people are under the impression and know now that October is Breast Cancer Awareness Month, and so just look out for that just in general. In the general media, I think we'll start to see a lot of that. But we're going to start that off here in the station today also, and we're going to talk a little bit about it and put our own little spin on things, and we're just excited to kind of get the word out, get people aware, and got two great guests from the health department this morning. We'll get to meet them here in a little bit. First off, I wanted to talk about a couple of events that are going on. We talked a good bit about this 5K that we're doing up at UVU. It benefits local students here, going to raise scholarship money. And it is coming up on this next Wednesday. So Wednesday the 8th, a week from yesterday, I think the race starts at 5:30. I think if you get there about 4:30, 4:45 to get your packet picked up. And go register early. I haven't talked to Mike to see if the first 80 have already taken all of our train tickets that were free for the first 80 participants, but if they have not, you can still go up and get one of those. Get you a t-shirt, $5 for a 5K to support that local branch of that university. Really, really great thing to do and a beautiful place to run. So we are going to also talk about just every Thursday morning, Real Foods Market does some food tasting. So if you haven't been over there on a Thursday morning, that'd be a good thing, fun thing to do today after you're done listening to the show. Head on over there, and usually it's Christy Parker that's in charge of that, so she should have some really fun things for you guys to try and sample this morning. So if you haven't eaten your breakfast, that'd be a good place to go and do it. Or if you've already eaten your breakfast and you're ready for a snack, that'd be a good thing to do too. And then also this Saturday, we talked a little bit about this fundraiser for the gardens in the schools run through the Heber Valley Food Revolution, and they are doing a sweat it out type of an event there at the Clock Tower this Saturday. It's from 9:30 to 11:30, and they're going to basically have a bunch of classes, a bunch of local trainers and things like that, and they're going to come and they're going to kind of show you what they do and make you sweat. And all of those proceeds are going to go to having a garden program in our schools, which I think could be a great little event. So go out and support that. Tickets are $30 for one person, $50 for two. And you just might see a local chiropractor there helping working on people just in case they fall and do something awkward while they're working out. So I'll be a part of that. I know they're going to have raffles and things like that. So really good event this weekend. So I encourage you definitely go check that out. As far as I came across this really fun fact, I really haven't done a lot of facts like I thought I was going to, but this one kind of made me laugh, kind of tickled me a little bit. We have a new record for the longest plank. Now, those of you out there know what a plank is. If you've done one, you know what a plank is for sure. And basically, it's, you're set up in a push-up position. Basically, you just don't do the push-up, and it engages your core, and it's really easy for about 3 seconds, and then it's really hard pretty much the rest of the time after that. So I'm going to ask our guests here if you have any idea what the longest plank that was just done. By the way, this was September 26th in Beijing. What would you guess the longest plank ever recorded would be?
Oh my goodness. I personally could maybe last 5 seconds. I would say 3 minutes and 40
So 3 minutes and 47 seconds might be the right answer. It is not. It's much longer than that. What about Janet? Do you have any idea?
Maybe 5 minutes?
It's even longer than that. I'm going to have you ladies do check your on button there on your microphone. I told them before the show started they wouldn't have to mess with that, and both of them were off now that we're finding. Janet's now has turned on, so neither of you heard their guesses. So maybe I can. Yeah, there we go. Now they're both on. Good grief. So
good.
sorry
so
about
we
that.
can start over and do a better guess.
Yeah, so now that you know your guess was wrong, you can try again. No, so I'll tell you the previous
do that.
world record holder was from 2003. It was George Hood was an American who did it for 3 hours, 7 minutes, and 15 seconds.
Oh, my God.
So that was what this guy in Beijing beat. So I know everyone's just sitting, waiting with suspense at what this longest plank is. 4 hours, 26 minutes. This happened like a week ago in Beijing. Some guy sat in a plank for 4 hours and 26 minutes without, I mean, he couldn't rest, right? I mean, he was in full plank position for that long. So I guess if we want to issue a challenge this morning, there it is. There's the bar for planking, and if anyone out there is excited to train and to change that, you have to beat 4 hours and 26 minutes, which I just think is insane. Maybe next show I'll try to plank during the whole show and see if I can last the hour, but I can promise you that I can't. So
I don't think you could talk at the same time.
no, you're exactly right. I would have to, I'd have to play a recorded one and just plank while it's doing it.
That's insane.
That would be weird. 4 hours. 4 hours. We can hear you a lot better now. This is good. In fact, let me have you introduce yourselves, and we'll start with Janet. Janet's from the health department. You're both from the health department. Kind of just tell me what your job is there, and then we'll get to the article I read, but it has much to do with what we're talking about today. So,
Well, my name is Janet Shelton, and I'm a family nurse practitioner. I've worked for the Wasatch County Health Department part-time for about 13 years. And most of what I do is work with the women's health programs. At the health department, we're all about wellness, and we're trying to help people in our community be as healthy as they possibly can be. And so that's getting cancer screenings on a regular basis and knowing what your cholesterol levels are and keeping your blood pressure in check. And we work with those things. I do checkups on kids. We have a well child checkup program and work with the kids that are in the Head Start program. So they get their yearly checkups and lots of things.
So a lot of just kind of checking up. I think we're starting to really realize that if we want good health, if we want not just to be not sick, we want to actually be healthy, that we need to check on some of these other things just instead of waiting for these symptoms to come up, right? I mean, how silly would it be for us to go to the dentist when we have gaping holes in our teeth? I think most of us realize, hey, I'm going to brush my teeth. I'm going to try to get there and get a cleaning every now and then. But sometimes we really do treat our health that way. In fact, we try to ignore a lot of these signs. And say, oh, it'll work itself out, it'll do its thing. But listen, I think if we can start to change perception and say, hey, instead of waiting until the engine falls out of your car, like, why don't you go in and get some of these things looked at? So we really do appreciate what you guys do there at the health department. And to Janet's left.
All right, so my name is Amber Poley. I am a health educator and a nurse at the health department. So with health education, we do a lot of preventative. We go into the classrooms at the schools and talk about tobacco prevention. Also, we do cardio. We do the Gold Medal Mile School, the kids' annual.
That's what I was going to ask. If that's
fair.
what you guys do, right?
Yes,
is the
that's
safe
a big
safe
one. We
kids
do that
fair.
every May. So the annual health and safety fair for the children, bike helmets, seatbelt,
car seats, all that
seats,
stuff. Sure.
just a little bit of everything. And then I also work in WIC.
Oh, good.
And in nursing, I fill in for Susan Holdaway when she's not there. I get to do all of the shots, the
Yay!
immunizations, so that's always
You
fun.
get to stick them and prick
Get
them.
to stick them. I know. I actually, this is so bad, but to say, but I actually enjoy doing shots.
No, that's not bad at all. That's de-stressing, when you can
exactly. I can just take my frustrations out on somebody else.
Yeah, listen, I think that's great.
And then I work with Janet in the cancer screening program.
So let's get to our topic of the day. We're really excited to talk about breast cancer. It's something that I think we can always be more aware of, something that we can always be more, I think we remember a time when cancer was kind of this really scary thing, that someone that you knew someone that had someone relative that, it didn't really affect, I think, everybody. The way that it really does now, I mean, I would imagine that if you take a poll among students today or anybody, and you ask them who in your family has suffered from cancer, I would think most people would raise their hand. I think, the statistics are getting to the point now that so many people are being diagnosed in their life with cancer in some form, that I think the perception might need to change a little bit as far as, again, it's this very scary, unknown, what are we supposed to do type of thing. We're very afraid of it, and so it almost becomes a taboo thing to think about, to worry about. I think sometimes we don't go to the doctor because we're afraid of that type of a diagnosis and things like that. And so I think hopefully in this type of awareness month, what we can do is start to make people aware of how common it is, how treatments have advanced, and how much better we're getting at treating something like this. And then not only that, but to realize that there are things we can do day to day to fight cancer, and I think that's one of the more important things. Is I try to be healthy because it feels good, because I enjoy how I feel when I'm at the top of my health. But on the other side of the spectrum, I also enjoy doing those things because I know it is decreasing my risk for some of these scarier types of things. And so the article that I read off of CNN actually was linking between obesity and cancer. And very interestingly enough, basically one of the main points of this article was that many people know, in fact, 90%, this is Dr. Clifford Hudis, who said 90% of Americans know that smoking is linked to higher rates of cancer, right? If you ask 10 people, 9 of them are going to say, oh yeah, we've heard that smoking increases your rate to have cancer. But on the opposite, less than 10% of Americans would realize that obesity is related to cancer. And so in that respect, if you ask 10 people, only one of them would know that, hey, obesity is actually another risk factor too. And then really what this doctor says is that obesity is a major under-recognized contributor to the nation's cancer toll and is quickly overtaking tobacco as the leading preventable cause of cancer. And so I think that's a significant thing to talk about, right? If especially here in Utah, we have probably less smokers, I would think, than a lot of other states, and so we think we got that side pretty good. But I will tell you that we are not immune from the obesity epidemic by any means. And so if we're feeling pretty good about not smoking and decreasing our cancer risk, then I think we also need to look and see what we're doing with our body shape as well, because that's such a big factor. I don't know. Do you guys know that? I mean, you guys know that obesity is a risk.
Yeah.
Yes.
It's actually, for Utah, it was really, we were high. And over the last 1 to 2 years, we've kind of leveled out.
Yeah.
So we're not increasing.
Well, that's good.
So we're kind of leveled out, but we still are high for obesity.
So this study was published in 2003 in the New England Journal of Medicine, and they actually had followed 900,000 American adults, which is a lot, over the course of 16 years. And really what they found was that excess fat could account for 14% of all deaths from cancer in men and 20% of those in women. That's deaths from cancer. That's not the diagnosis. That's actually deaths. And so even just decreasing the obesity in our nation, in your household, in yourself, you can change your chances of dying from cancer by 14% to 20%, which is a high number for sure. In fact, really, we just said that the American Association for Cancer Research Journal predicted the top cancer killers in the United States by 2030 would be lung, pancreas, and liver, largely in part because of the rising obesity rates. That these are big-time cancers that are that are controlled a lot by our obesity. So just kind of interesting to kind of put that spin on it and say, yeah, we know that obesity is a problem, right? We have diabetes, we have high blood pressure, we have all these other issues that are going along with obesity. And I guess to throw in another, hey, if there's any other reason for you to try to check and work on that a little bit, cancer can be very regulated by some of that. So, yeah, Janet's wanting to say something. I'm sorry.
No, what I had read said it's not just obesity, but the lack of exercise.
Sure.
And so, if you're lucky to have those thin genes,
but you're not working out.
You're not working out. You're still at risk. And, if you're unlucky and you feel like you've got the heavier genes or whatever, then exercising can make a difference regardless of the numbers of your weight.
Right.
So the key is to get some kind of exercise program going,
So we have some reduce your risk types of things here at the very end of this article, and so we'll talk about those for sure. But this is what they say: the very first thing, stay active, eat nutritious foods, get 7 to 8 hours of sleep at night, and manage your stress levels. That all these can help with a healthy weight. And even just that kind of, I think what they said was about 2.5 hours a week of even just brisk walking can lower your risk a ton. Whether, like Janet says, whether or not what the scale says, if you're engaged in that type of activity, then you can be good. So I think it's a really good idea to be out and about and be doing things anyway. But if for no other reason, we're talking about cancer, we're trying to get aware of it a little bit this month, maybe start to try to do something like that, especially when the weather's a little cooler. You can go out and a little bit later on in the day. You're not going to quite sweat as much. I always talk about exercise being kind of a bad word sometimes. People don't really like to talk about it because they feel like there's a specific thing that they have to do that they don't like. Where exercise really can be very therapeutic, very fun to do, and people can really enjoy doing it. So pick something you like to do, and if nothing else, you can just go out and walk a little bit. And who doesn't like to walk?
Yeah. Right.
If you can.
So that just kind of leads into a program that we did 2 years ago at the health department, and we had so much fun with it and such a great results that we've kind of kept it going, and we called it the 5210.
Okay.
Which is to make sure that, and this is not just for adults it's for everyone.
Right.
To make sure that you are getting so the 5 stands for the 2 fruits and 3 vegetables. So
okay.
You're getting your fruits and vegetables in. So
per day, hopefully.
Per day. So
some people get that in a week.
2 servings of fruit and 3 servings of vegetables. So
okay.
That's the 5.
There's your 5.
The 3 is shoot.
Is this per day? Let me think
yes,
what 3 would be.
It's 5210.
Oh, 5210.
Oh, okay,
that's
good.
Right.
So 2 something else.
That's all of a sudden. Thank you.
I think you did say 5210 at the
do.
beginning anyway,
okay,
so you're good.
So the 2 stands for 2 hours or less of screen time.
Okay, yeah.
So when our children get home from school, we need to limit their screen time. So that's TV, that's computers, they're FaceTiming.
Yeah.
So they're getting out and getting active. And then the 1 is 1 hour of exercise.
Of getting out and running around and sure.
So they're just active. They don't have to go run on a treadmill, but just getting 1 hour of physical activity. And the 0 stands for 0 sugared sweetened drinks. So
I like
no
that.
soda, no the energy drinks,
right,
things like
right,
that.
right. So
drink plenty of water.
Lots and lots of water. Get your 6 to 8 ounces or 6 to 8 glasses of
right,
water in
right.
a day.
5210, and great things that everybody can do. I know it's specific to kids because I know a lot of that research. But if everybody did 5210, that'd be fantastic, wouldn't it?
That's right.
And here we are, exactly doing things to lower our risk and stuff like that. Let me give a shout out to actually a local woman here has started a Wasatch Walking Club. So if you're interested in doing it by, with other people, I think they meet out at Southfield Park. I'm not sure exactly all the details on it, but I just kind of thought about that while we were talking about if you wanted to get out and walk. There is a Facebook page. So if you go to Facebook and search out Wasatch Walking Club, and I believe the organizer here is the one that posted this on this site, and her name is Robin Lloyd. So Robin, if you're out there listening, here's a shout out to the Wasatch Walking Club. Go out there. It said that there were a few people last time, and I think they do it weekly. So that's something you can definitely go out and do. There are plenty of resources out there to get healthy and get fit. So I love that program. I think it's fantastic. I think people don't realize the amount. Last week we talked with Leslie Smoot about sugar and about how we shouldn't, be eating as much sugar as we are and drinking specifically. And I'll tell you that the statistics of how much of our calories come from what we drink, even in the young kids, is astounding. I think we definitely need to get more water in us for sure. Let us get on to talking about breast cancer. Now, I've got some statistics. I've got some things that I've looked at that were interesting to me, but I'm going to kind of let you two, especially Janet, I know you're kind of the one in charge of that area in the health department. I don't know, you can kind of go off on what you're thinking about doing, but I know we talked about before the show that there are some really, really good resources out there for the women in the community to take advantage of at the health department that maybe people don't know about. And so it's going to be breast cancer specific, but there will be some other things and other resources too for just women health in general. But I want to kick it off with this latest as far as some of these statistics. And the one that kind of surprised me was that 1 in 8 U.S. women, which is about 12%, will develop some sort of invasive breast cancer over the course of their lifetime. I don't know if that's around the same statistic that you have.
It is.
But 1 in 8 is, it's a pretty high number. And so tell us what we can do here in this county especially, that we can start to combat that a little bit, that we can start to raise awareness some.
Okay. We have... The biggest thing you can do is get that annual mammogram.
Sure.
And there's been some groups in the last couple of years that have come out saying, "Oh, you don't need that mammogram every year. Maybe you should go every 2 to 3 years."
Yeah.
A little bit of controversy.
I've seen that actually, for sure.
And it's definitely a personal choice. But I guess I want you to know that the American Cancer Society and the Utah Cancer Control Program, the Utah Cancer Action Network have all had panels of doctors and specialists that have met together and reviewed the statistics, and they really feel strongly that annual mammogram from age 40 on for women is critical.
So until we hear anything different from those big organizations, we still like the one a year.
Mm-hmm. We do. We
Good.
Really encourage it at the health department, and I have seen it make a difference.
Sure.
If I can give a personal example.
I think for sure.
My mom was very religious about having annual mammograms, and the one mammogram was completely normal, and exactly 12 months later when she had her next one, the cancer was about 1 centimeter. She had
Sure.
a fast-growing cancer, and it made a difference in the course of her treatment to find that cancer early. And if we'd gone every 2 years, I don't think we would have been as successful in treating it.
Now, the one statistic I really like too comes out of the American Cancer Society, and I'm hoping that this is correct, but they say that up to 99% of breast cancer is curable if detected early. Is that?
And that's the key word.
I agree.
Right, and so the early detection is where we're in. So again, I think one of our biggest problems is ignoring some of the signals our bodies are telling us, ignoring some of these things and trying to play them off as, oh, it's fine, it's no problem. But we need to be active in making sure that we get some of these things looked at and checked out, because if we detect them early, and that's not just in breast cancer, that's in pretty much all of them. The earlier we know, the easier it is to treat them, and the more, the better the mortality rate, that kind of a thing. So, yearly mammograms, that's something for sure that and you say over 40.
Yes, women age 40 and over.
And I know that cancer, all cancers, they all increase the older we get. And I know also when estrogen's different and menopause starts to come on, stuff like that, that's another time that kind of bumps the risk there in women, if that's what I understand correctly. So, and there are, don't we have some kind of we were talking about free mammograms. Tell me about free mammograms, Jen.
Okay. So yeah, often the concern is I don't have insurance, or my insurance isn't covering the mammogram, and they are expensive. And so our county has approximately 80 to 100 free mammograms or coupons for a free mammogram that we can give out. And you just need to meet the federal income guidelines, and they are generous. It's based on your income and your family size. So
we like the family size aspect here in Utah.
Yeah, it makes a difference.
The guidelines are huge, from 28,000 to over 100,000.
Yeah, so depending on what the family size is. Sure.
So very generous guidelines.
Yeah.
And so we've got almost 100.
Yeah. And if we don't use them, we lose them.
Yeah.
So we want to find those women in Wasatch County that need them. They're here. They're waiting for you. And we're just happy to serve any woman that would like to come in and have her mammogram and get screened. And so just give us a call at the health department. That main number is 654-2700 or 657-3307, and ask about the program. It's part of the Utah Cancer Control Program, which is a statewide program. So if you have family in other counties, have them check it out. It's all over the state, and we're here to make sure women get screened. Utah has one of the worst mammography screening rates in the country. Why is that? Utahns are healthy people. We should want to safeguard our health, you know? So this is an opportunity to do that. And if you do have insurance, that doesn't disqualify you. I have some women, in fact, with the Affordable Care Act, most insurance companies agreed to cover the initial screening mammogram. But what a lot of women don't know is that if the radiologist sees anything slightly suspicious, he will need to double check it with either what we call spot compression, a magnified view, or an ultrasound. And once you're past that initial screening, many insurances don't cover the cost. And so if they're concerned about that, again, they can come through our program. We'll bill the insurance for the first one, and then we'll pay for those additional views until we're sure that there's no cancer there.
That everything's clear.
Yeah. And so it can really make a difference. So if you're unsure of how it would work with your insurance or without insurance or your income, give us a call and let us talk it through with you and see how we can help you. There's a lot of options.
I mean, a great resource, really it is. And if you're just wondering at all, why not just give a call? And that's the one fun thing about all the guests I've had on is I've always said, well, just call, just talk to us, figure it out. And definitely this is another place. I did want to shout out to the men out there too that are listening, because we don't want us to just feel like we're just talking about women. A man's lifetime risk of breast cancer is about 1 in 1,000. So it's not, a huge risk by any means, but it's not tiny. If the odds of winning the lottery were 1 in 1,000, I'd be out playing for sure. That's something to know. And so it's not just a woman disease for sure. And if we just talk about cancer in general, we're getting to the point where about 1 in 2 men are being diagnosed with some sort of form of cancer in their lifetime. So definitely we talk about screenings. We talk about, hey, let's make sure we're looking, but there are other things we can do, right? Actively. I think we talked about, a lot of people worry about the genetics of cancer. And I think it's interesting to read some of these articles that talk about obesity being a preventable form or a preventable lifestyle choice or thing to decrease our risk of cancer. And so there are definitely things that we can do day to day. And I don't know, Janet, what you found on that kind of thing. I've got a few things here myself, but I think if we just sit and kind of wish and hope that our genes are good and then don't do anything else, we're missing the bulk of cancers, aren't we?
Yeah.
In fact, really the statistic that we found, and you saw a lower number, but this one did say that up to 85% of breast cancers occur in women who have no family history of breast cancer.
And in this
which is
article in the
huge.
Desert News, they were saying that was one of the main reasons that women said they were not being screened, is
Right.
because they
'Cause
didn't
they
have a family history.
Right.
But if 85% don't, they need screened.
Yeah, 15% is not a high number. I mean, it's a number for sure, and it's something to know. But if 85% don't have family, genetic disposition, then we're talking about things that we might be able to do and things that we might be able to control. And for sure, screening is part of what we can do. But what can we do? What did you come across, Janet, or what do you usually counsel people on kind of a day-to-day type of basis? What should we be doing? What should we be paying attention to decrease our risk?
Well, we've talked about staying active and keeping our weight, keeping a healthy weight. And, I think we used to do a lot with self-breast exams, and we would encourage women to do that every month.
Sure.
And some of the groups have, like the American Cancer Society, have backed off on that a little bit and taken a different approach, let's say, of more a general body awareness.
Okay.
So, as women, let's know what's normal for us. Nobody knows what's normal for your body but you.
Right.
So, hopping in the shower, we're soaping up, we're getting scrubbed up. Let's know what our body normally feels like. And breast is lumpy, bumpy. There's lots of bumpy tissue in there. You've
Right.
got milk ducts and lymph ducts and tendons and all kinds of things. And so you're going to feel a lot of lumps. But if you know what's normal for you, then you're going to notice a change. And so if you suddenly have a jagged lump that's growing, an unusual shape, an unusual texture, it's hard, it doesn't move with the rest of the tissue,
Yeah.
you're going to go, something's up.
Yeah.
I maybe ought to go get this checked.
Right.
Or, gosh, I've got this pea-sized lump under my arm that's
Yeah.
tender and
Right.
hurts, and that hasn't been there before, and maybe I ought to get that checked. Or I've got a rash, and I've tried cortisone and lotion, and
Yeah.
it's not going away. Because
Right.
there's one type of breast cancer that appears as kind of a red, swollen rash, like,
Yeah.
and so if we just know what's normal for us. In fact, I had one woman tell me, I know my own body, and my right breast has always been slightly larger than my left.
Yeah.
And they are now the same, or the left is even slightly bigger. And
Huh.
she found her own breast cancer
Yeah.
just by knowing what's normal for her and standing up for herself and letting the doctor know there's a change here.
Yeah, and saying, hey, we need to investigate for sure.
Yeah.
I think a lot of that early detection really does, and I've seen some statistics about it has a lot to do with the woman coming into the doctor and saying, hey, something's different. I've noticed something different. And I think if we learn how to, like you say, pay attention to some of those things and how we're feeling and how the body feels and those types of things, that and then to investigate. I just can't stress enough that problems don't just disappear on their own, that we just can say, hey, we'll just wait and we'll see what happens. I mean, it's so imperative to get these things checked out. Not only because, if I go in and I found something and I go in and get it checked out and all of a sudden it does come back and it's one of these scary diagnoses, well, guess what? Because I went in early, now my survival rate, my chance of beating it just increases by so much than if I were to say, hey, I'll check this out again in 6 months, and see if it's any different and hope that it's gone away. Anyway, so I always encourage, anytime you're feeling anything different about your body, that's a good time to go investigate. And whether it's, if it's something like that, go to your regular doctor. If it's other things, there are other healthcare practitioners that we've talked about and talked to in here that you can also have them help investigate. And so, we are getting a call, and I am going to even try to answer it and see if this is, I always get nervous doing this, and I should probably just quit answering the phone. But let's see if this is pertaining to what we're talking about. KTMP, you are on the air.
Good morning.
Good morning. Who am I talking to?
Oh, sorry, I was calling to request the song.
I figured it'd be on a different. That's okay. We're doing our show here for another 23 minutes, and then someone else will be in hopefully in a little while that you can call and request a song for sure.
Well, all right. Well, what are you talking about?
So this is a health show. We're talking about breast cancer awareness, because October is Breast Cancer Awareness Month, and most people think, oh, well, that's a ladies' disease, so I'm going to listen to the ladies, let them listen to it. But I'll just tell you that 1 in 1,000 men do get breast cancer.
I've heard of it.
I'm sure you have.
I really have. I have heard of it. But hey, good luck on it, and I will give you a call back.
Hey, give a call back and we'll get the song played for you, whatever you want to listen to for sure.
All right.
No problem. Take care.
Bye.
All righty. So again, this is why I don't answer. So you were asking if people call in if I ever answer the phone. Not that I mean it's not inappropriate to call a radio station and request a song, but I'm not playing songs right now. Sorry. Anyway, and see, then it throws me off my track, and now I'm like, okay, what are we even talking about? So let's talk about risk factors, Janet. I kind of looked this up also, and I was really interested in some of these risk factors. And I talk about there's obviously risk factors that you don't have control over.
Yeah.
And we've talked about that, right? I can't control a lot of my genetic things. I can't control whether or not some of these issues. In fact, I'll go through some of these non-controllable, so you don't have to worry too much. Your personal history of breast cancer is something that not necessarily you can control, and so a lot of people have increased risk of new cancers even when they've already had one before. We talk genetics, we talk aging. We wish we could, not age as fast or whatever, but that's something that just continues to happen. Gender, obviously, another thing that we don't really control. So those are some of the things that we don't control, but I'd rather talk about the things that we can control. And like we say, lifestyle-related factors, breast cancer risk. This is, the CDC has called cancer a lifestyle-related illness, even though there are some forms that you can't change. There are some things you can't change. Here are some things you can. Now, with breast cancer specifically, it says that women who have had no children or have had their first child after 30 have a slightly higher risk, which I thought was interesting. And so here we are in Utah.
Doesn't happen in Utah.
I'm about to have my fifth, in November. I shouldn't say. My wife's about to have our fifth. And so we have kids. But that's interesting. The effect of pregnancy is different for different types of breast cancer. And so it says for a certain type of breast cancer known as triple negative, pregnancy seems to increase the risk, which is interesting. But in general, people that women that have pregnancies tend to have a lower risk, which I think is something I never really knew about. And then also the birth control can also slightly increase your risk as well. And so even the oral contraceptives and some of the injectable ones.
That's kind of tricky, though, too. Because
tell me about it.
It can decrease your risk of ovarian cancer to take birth control.
Right, because I know a lot of people that are on birth control sometimes for those irregular, cycles and things like that.
Yeah.
Once the cycles are irregular, then you're increasing your risk for all kinds of different things. And so I know that that's a way to treat those. And so, yeah, I mean, which one do you want, I guess?
I think you have to look at the individual and their personal risks and,
sure.
Make a list and see what's most important to them and what's going to help them the most.
Right.
We're always looking at pros and cons and risk versus benefit
right.
with each individual, and it's different.
So drinking alcohol was clearly linked to an increased risk of developing breast cancer, which I thought was interesting. I think that's definitely something that we can look at. It says here those who have 2 to 5 drinks daily have about a 1.5 times the risk of women who don't drink alcohol. And so that's definitely one that you can kind of control for sure. And then we did talk about being overweight or obese, especially after menopause, which is interesting. Now the science behind it is, right, what we've started to learn is an increase in estrogen in women is an increase in breast cancer risk, right? And so that's why we used to do, hormone replacement therapy, and we used to, give women that were, especially postmenopausal or in the middle of menopause, we used to give them estrogen to help them out, and then we started to realize that might have been a negative thing, so they don't do that as much. But what happens is when you have increased fat tissue, you actually increase your estrogen. That's in men and women. And so that's where obesity really does become an issue. Now, obviously, in premenopausal women, a lot of your estrogen is being produced there by, the ovaries. Sorry, I don't know why I couldn't think of ovaries. Anyway, but once menopause sets in, the ovaries stop making it, and so the estrogen is really going to come from the fat tissue. So having more of that fat tissue gives you more of the estrogen. And so like we talked about before, physical activity in the form of exercise reduces breast cancer risk. And so most people say, well, how much? And so this is what I was looking for. As little as 1.25 to 2.5 hours a week of just brisk walking reduced the risk by 18%.
Wow.
And then walking 10 hours a week reduced a little bit more. But they said that was kind of that magic number of that. 1.25 hours to 2.5 hours, and you reduce your risk by 18%. I mean, it's a huge number.
Yeah. 15 to 30 minute walk a day for 5 days.
Easy.
Not even 7
Not even
days
7,
awake.
right? Take 2 days off.
That's great.
And so hopefully that's something that people can start to really want to do. And then there are some unclear factors, too, that I ran across. Obviously we're not really sure about, the benefits of taking certain vitamins, certain foods, things like that. We're not really sure with even environmental chemicals. We hear a lot of this. There's a lot of kind of craziness out there too, that I run across in some of the circles that I run in, people that aren't, that won't drink certain plastics, that aren't using certain deodorants and things like that. But really those links haven't been shored up as much as some of these other ones that we've talked about. And so I think if you're not using deodorant, but you're not out walking briskly, 2.5 hours a week, then maybe there are some other things that you control. And so that's why I would say is stay within the realms of those, and then if you're doing all of that and you want to maybe say, hey, maybe I'll try to even do better, then you can, reach into the realm of some of these things that maybe aren't quite as sure. But some of these other ones that we know of, the alcohol use, the exercise, that type of stuff, eating better, fruits and vegetables. I love the 5 per day. I heard a statistic actually that if you check into one of those cancer treatment centers in America, they actually push up they want you to have 9 to 11 servings of fruits and vegetables a day.
Mm-hmm. Yes, indeed.
Yeah.
5
Which
is just
is-
a place to
Yeah.
start.
Yeah, which is a lot. I mean, I try to get around that. That's kind of what I thought is if I had cancer and my body was trying to fight it and using 9 to 11 servings of fruits and vegetables was helping my body. And I thought, well, if I don't have it, doing that right now too would be very helpful. In preventing it. But I'll tell you, anyone that's tried to do 9 to 11 in a day, it's not easy.
No.
Years ago, the slogan was 5 a day, but now they've changed to more matters. So
Sure.
just as many fruits and vegetables as you can get in a day.
Get in there.
Yeah, and it's pretty easy if you do a smoothie in the morning.
Yeah, that's the only way I've known how to do
Yeah,
is to get a
you can
smoothie
get a lot
in there.
Of veggies and fruits
Right.
in there, and that's what I
Right.
kind of counsel the women that we talk to.
For sure, because really I think if you're not doing that at all, a lot of times you're not getting close to that 4 to 5. I mean, some people think, 5, that should be easy. Right, and so they kind of think that they do, but I'll tell you, if anyone looks at their diets day to day and they're not actively trying to get at least the 5, they're probably not getting even close.
Yeah.
That's been my experience. Janet, you were trying to say something too. I keep interrupting you. I'm sorry.
We were just going to say also one of our great resources that we have at the health department is a program called Be Wise or Wise Women.
Yeah. Talk about
And
wise women.
It is for ladies that are between the ages of 50 and 64 that meet the federal income guidelines, which we had mentioned before are very generous. And we go in, you make an appointment, you come in fasting, and we do some blood checks, which checks your cholesterol, checks your blood sugar.
Right.
We check your hemoglobin to make sure that you're not anemic.
Right.
We check your blood pressure, your height and weight, get your BMI, and then we do some lifestyle intervention with the ladies, and so they can pick out several areas as we go through their test results
Right.
in what they would like to improve on. And we usually focus on healthy eating and exercise.
Sure.
Because that's kind of the key to everything is
That's really what we're finding out, right? That we're not moving enough and that we're eating too much.
Right.
We got to flip those,
Exactly.
right?
So-
Well, let's not eat not enough, but let's eat less
But it
and
is-
move more.
It is a great program. We have tons and tons of tip sheets that
Sure,
we can give
sure.
you. Also, exercise. We have resistant bands,
There you go.
exercise balls.
Sure.
Amber makes it fun. She has lots of goodies.
They have
Come on up and
tons
get a bag of
tons.
stuff to get you
Yeah.
started.
Tons
you
of
know?
fun incentives and
Yeah, yeah.
that's good for them.
But I love that. You know what? I think so many of us just get lost in the there's so much to think about, right? There's so many of these areas, like you say, and say, well, maybe I'm working on my cholesterol, but something else comes up, or I'm working on my blood pressure and something else, and so we're just not really sure sometimes how to tackle that. And that's why having that, personal coach, somebody to say, hey, this is what you can do. Here are some goals that we can set, and sitting down like that. And that type of a program generally is very expensive.
Yeah.
People that do that for a living charge quite a bit. And so to have that resource as something that can be, depending on obviously what your income is, but if you
and
can
just
qualify.
the blood work alone, if you were to have it done at the hospital or somewhere else, it ranges between $200 and $300.
Right, sure.
And this is a free service for the women. And then right after they get done talking to me and we set their goals and they have all their blood work values, then they get to go in and see Janet and for the rest of their exam and get their mammogram voucher. And
Right.
why not? I feel like we should keep the money in Wasatch County, not be giving it back
Yeah,
to
exactly.
the state. So we really want to reach our goal of 100 women coming into the health department and
I
receiving
think it's a
these
great goal.
benefits
And what a
resources.
month to do something like that when it's already Breast Cancer Awareness Month.
Yeah.
Well, and the other thing is, we at the health department don't want to just focus on those within those income guidelines.
Sure.
Regardless of what you make, we usually have a way of accommodating you.
Right.
Exactly.
So we have some clients that their income's above that, but they don't have insurance. And so, in fact, I have some that have diabetes, and that's a challenge to
Yeah,
get regular medical care and fight that without insurance. And so, if you need your cholesterol checked or your hemoglobin A1C checked to keep an eye on that diabetes, we can do those tests for $20 a piece, regardless of your income.
Wow.
And so, really, honestly, there's a way to help anyone, whether you make $300,000 a month or $10 a month. We have a way of helping you, and the women's health programs, you can still get the clinical breast exam and the screening for cervical cancer for $40, regardless if you meet the income
Wow.
guidelines. So we really do have a lot of options, and we don't want you to feel like you're turned away because you're not in that niche.
Now,
we
if
want
you
to reach
make-
out to all Wasatch County
If you make
residents.
$300,000 a month, I want you to pay for two when you go in, and then somebody
Donate one
So-
for
exactly,
someone
don't-
else.
Exactly.
Wouldn't that be a treat?
How would it be to make $300,000?
But the health department, I feel like we are a great resource, and we want the community to utilize us more.
Right.
We actually have a class that we're going to be offering in March, April sometime.
Sure.
And it's called the Living Wellness Program.
Uh-huh.
And it is for people that have any chronic disease. And it's not just for the people, it's also for their family members as
Right,
well.
right.
And if you have arthritis, diabetes,
Yeah.
asthma, any of the, you're a cancer survivor.
Right. Because I think that is one of the definite, issues that we have as far as health goes is, what if I do have something like this, right? We talk a lot on this show about trying to prevent a lot of that stuff. But what if I have it? What if I do have cancer? What if I'm going through treatments? What if I'm a survivor, but I have a higher risk to get it again, right? What if I have rheumatoid arthritis, multiple sclerosis, some of these things, ALS? We were talking about the ice bucket challenge, right? There's got to be still something we can do. And the interesting thing is a lot of these things we do to prevent also do help with the course of these diseases. In fact, that was one of the things that on one of these articles that I read about breast cancer, as I said, a lot of these things that we do, the fruits and vegetables, the exercise, that kind of thing, they're trying to now do research as far as how does that help people that already have it or that have already been diagnosed with it. Is it something that contributes to their recovery, because that was another thing too that obesity did for people that have cancer, is it made it harder to treat it, harder to find it, harder to treat it, that kind of thing. And so they're trying to now say, if someone loses a lot of weight after they've been diagnosed with cancer, does that help? That kind of thing. But most of the time we're just pointing the finger at these simple types of things that we've talked about on the show so often, is move a little more and eat a little less. It just seems like we're a broken record in here. But when we bring in all of these conditions that we're doing. So I like that program, the the Live Well, and then that class is
The
coming
Viva-
up.
yeah,
And
the-
for sure, as that gets closer, we'll have you back on. We'll get people signed up to do that, especially if because there are a lot of people that suffer with a lot of things, and sometimes it's hard to know how to really get along with those types of conditions. And I would say that if you're out there suffering with it, there are resources, there are ways to live better, and not just have to sit around and just say, well, I got the disease, so now there's nothing I can do.
I've had some women say, I'm not going to come in and get the mammogram because I don't have insurance, and if you find cancer, I'll have no way of fighting it.
Yeah, tell us about that, because...
Well, again, if you meet those income guidelines, you would also qualify for emergency Medicaid if we do find cancer.
Sure.
And the Utah Cancer Control Program follows you all the way through and pays for everything until we've got results of that biopsy and we know for sure if there's cancer there.
Right.
Once you have that cancer diagnosis, they'll assist you in the fast track program to get onto Medicaid so that you can have an oncologist and the physician team that you need to go through that fight, you know? And so don't feel like there isn't help out there, because there is.
Well, and it is kind of a fun. I mean, you think of it that way. You say, okay, well, yeah, I don't want to get the diagnosis because then I might not have the money to treat it. But I mean, then what else are you going to do? If you don't get it diagnosed and you don't get it treated, then the outcome's not that great either.
No.
And so, what's more expensive?
A funeral.
Exactly.
No, that'd be bad.
And I think we get to that point in our lives that we talk about that ignorance is bliss, and I just don't think that's true with our health. I think if I love the diagnostics that come back on my car. I get an email every month that says, "Hey, here's how the car's doing."
Well,
like what if we had something like that? And that's what we're trying to do here, right? What are these things that we can pay attention to? What's my, if I hate to make car analogies because I don't know anything about cars, but how's my carburetor running? How's my radiator fluid? How's my, all these kinds of things. What can we do to look at those types of tells in our own system and say, and that's what we've got. That's what we go in and we get these things checked out. How's my posture? How's my stress level? Those types of things.
Yeah. And Amber doesn't just meet with you once to talk about changes to your lifestyle. She'll give you a call 3 months from your appointment and check and see how you're doing on the goals that you decided to focus on, and see if you need any more support. And lots of ideas, like if you choose walking as your exercise choice, let's get a friend to go with. Let's have some support. Let's put a little reminder on the fridge. Let's tally your points and reward yourself with a smoothie. I don't know. Somehow make it fun. Give yourself some support to do
Well,
it.
and I think we talked about this last week too, that support is very, very key in any type of lifestyle change that we're trying to make. It's very easy to look at it and say, oh, I should lose weight. How many people have said that today to themselves?
Exactly. And I try to help them break down their goals. Like if they say, oh, I need to lose 40 pounds, well, we break it down so it's 40 pounds sounds very overwhelming.
Yeah, because
so
it ain't happening
break it
tomorrow.
Down and let's work on 3 pounds a month. And get it so it's realistic and do it over a year's period of time.
Yeah.
Same with exercise. I mean, if somebody told me, okay, you need to exercise 1 hour a day, I'm thinking, oh,
it's
my
a lot,
goodness,
right? Where am I
busy.
going to get
I'm
an
working,
hour?
I'm a mom.
Sure.
You have all these things, and so you can break it down. And the key thing is that you are getting a half hour of physical exercise in a day.
Yeah.
And it doesn't need to be all at once. It can be 15 minutes here, 20
5 minutes of
there.
chasing the kids.
Exactly. And then we just have one other fun thing going on for our Breast Cancer Awareness Month. And if women come into the health department and they receive their mammogram voucher, also, and they do the breast exam, they receive a mini pedicure.
Now you're talking.
Yeah, at the salon. So we've been working with all the salons in Heber.
Yeah.
And they'll receive a voucher to go have a mini pedicure at the salon, and we provide the polish and the little stickers for their nails, and so it will be a fun thing. So we just want to reach our goal.
Yeah,
we
that sounds great.
We want to take care of our people in our community. And we want them to utilize the health department. One other plug for the health department. Remember, we have our flu shots in. We have the mist, the intradermal, the high risk flu.
Right.
So remember the health department and
Well, and I think for sure this is something that I underutilize. It's something that if anyone out there just has health questions, it's such a great resource in the community. And I think sometimes we just don't think about it, and we have there's a Facebook page. I don't know if you two have ever been on it. It's called Ask, and people ask all kinds of great questions about anything or vent their frustrations about things. It's always kind of a fun thread just to read for entertainment purposes. But there are a surprising number of health-related questions that come up on that page. And the interesting thing is we're just left to hope that someone that knows what they're talking about is going to answer the question, right? And I've seen some of these where I get a little nervous and think, man, some people are kind of overstepping their bounds as far as what they know about and recommending certain treatments and things like that when I think, well, why not just pick up the phone and call the health department? You can talk to an expert that day and say, hey, you don't have to make a doctor's appointment and pay a copay to go in and ask a question. If you're just curious about something, I think it's a great resource. And so hopefully what we can do with having you two on the show, and we've had, last month was Family Mealtime Month, and so we had the health department on that day. And so hopefully what we can start to do is get a little more utilization out of the health department. That's definitely a goal of mine with this show, is to put you guys more in the spotlight and say, hey, here are things that you can do. Here's a place that you can go to get some questions answered.
Well, and let's get the community working together. We've really appreciated the support of the salons and donating these pedicures to the women.
That's so fun. I think that's
that,
such a great idea.
And last month the hospital put on Girls' Night Out,
right.
And I saw women with their sisters and their mothers and their friends all encouraging each other to get out and get that mammogram.
Yeah.
And, it really makes a difference when we join together.
That's a fun event, isn't it?
It is. If you missed it, you need to go next year, every September.
Speaker.
I had somebody I knew, and they came in. It was 4 generations, right? You had grandma, and you had mom, and then you had lady, and she had just had a baby. I was like, this is just fantastic. I mean, really, that's how we start to change the direction of the health in America, right? Is to start to really get families involved, get support systems involved, and start to say, look, we're tired of the status quo. We're tired of the 1 in 8. We're tired of all of these, things happening that really can be very preventable, right? If everybody did a few things every day. I love the idea of, if you got 40 pounds to lose, don't think you're going to do it in a month. Because if you do it in a month, I can tell you haven't done it in a very good way. Right? And so let's think about a year. Let's think about 2. Let's think about how healthy am I going to be 5 years from now, right? Am I going to feel better in 5 years than I do today? Because it's possible. Am I going to feel better in a year than I do today? It's definitely possible. And those changes that last that long, that we can sustain over a year's time, those are the changes that have actually taken hold, that have become habits now. And it's our new lifestyle, not just, something we're trying to do for a month. Plank for 4 hours. I don't know.
We want to keep those 40 pounds off.
That's right. Yeah.
And the way to do it is slow and steady and make that change.
Well, you guys have been really, really fun to have on. Tell me if you got anything else burning that you want to say. We're about past our time. When I said we were going to talk for an hour, both your eyes got very, very wide. But like I say, it goes by pretty quickly. Great information. Fun to talk to you. Like I say, tell me what else is going on, or give another phone number to the health department just in case anyone out there was like, wait, free pedicure? Hold on, I just heard that. I want to write down this number.
So our main number for the health department is 654-2700.
And if you want to talk to me directly, call my office, leave me a message. I'll get back to you at 657-3258. I'd be happy to talk to anyone with any question, or I'll direct you to someone else more qualified there at the health department. I do want to mention we also really appreciate the mammography staff at both Heber Valley and Park City Medical Centers. They support us a lot. That's where you take our coupons. Is to them you get the best of the best when it comes to mammogram technology. And yeah, we just come try us out, I guess.
All right. Well, thank you for coming on. And those of you listening, I appreciate you listening. I'm actually excited because this one did get recorded this week. Last week I didn't get it recorded. I was very angry, but I'll have Leslie back on to talk some more sugar with us, and we'll get that one recorded for sure. But we'll get this one out there, and thanks for being a part of the show this morning again. And get out and be healthy. The sky is blue. It may be a little chillier, but it's nice outside. Get out and get your walk in today if you got the time, and be healthy, and if you do it for no other reason, then of course just do it for the health of it. Thank you for listening.